Welcome to this exploration of the science and health benefits of belief in God and religion, a topic that bridges ancient wisdom with modern research. For centuries, humans have turned to faith as a source of comfort and guidance, but only in recent decades have scientists begun to quantify its impacts on our well-being. Studies from institutions like Harvard, the Mayo Clinic, and Stanford reveal that religious involvement often correlates with improved mental and physical health outcomes. This isn't about proving or disproving the existence of a higher power, rather, it's about understanding how belief systems and spiritual practices influence our bodies and minds. Research shows that people who actively engage in religious activities report higher levels of happiness, lower stress, and even longer lifespans. For instance, a comprehensive review by Dr. Harold Koenig, a leading expert in religion and health, analyzed over 3,000 studies and found that 79% demonstrated positive associations between religiosity and better health. These benefits stem from multiple factors, including the social connections fostered in faith communities, which provide emotional support and reduce feelings of isolation. Prayer, meditation, and rituals act like cognitive behavioral therapy, rewiring thought patterns to promote optimism and resilience. In one Stanford study, anthropologist Daniel Luhrmann highlighted how deep faith creates a sense of relationship with the supernatural other, leading to meaningful personal change. This relational aspect activates brain regions associated with empathy and social bonding, similar to conversing with a friend, which in turn boosts immune function and lowers inflammation. Globally, comparative studies show that in countries with high religiosity, individuals pondering life's meaning through faith report better health, especially in less developed regions where community ties are crucial. Even in secular societies, spiritual practices without formal religion yield similar advantages, suggesting it's the act of seeking transcendence that matters. Physical benefits include reduced risk of chronic diseases. For example, religious people often avoid harmful behaviors like excessive drinking or smoking due to doctrinal teachings that view the body as a temple. This leads to lower rates of heart disease and hypertension. Mentally, faith offers coping mechanisms during crises, reducing suicide rates and substance abuse. A Pew Research study across 26 countries found that actively religious individuals are more likely to rate their lives as happy and engage civically, which further enhances health through purpose and belonging. However, these effects vary by how God is perceived. If loving and supportive, benefits amplify. If judgmental, they may diminish. Overall, the full story of faith's health impacts paints a picture of holistic well-being, where belief isn't just abstract but a practical tool for thriving. As we delve deeper, we'll uncover the mechanisms behind these findings, drawing from neuroscience, epidemiology, and psychology to illustrate how something as intangible as belief can manifest in tangible health improvements, encouraging even skeptics to consider incorporating spiritual elements into their routines for better quality of life. Diving into the mental health advantages, belief in God and religion emerges as a powerful buffer against psychological distress. Numerous studies indicate that religious individuals experience lower rates of depression and anxiety, thanks to the structured support and meaning-making provided by faith. For example, the National Alliance on Mental Illness notes that spirituality can foster connectedness, hope, and purpose, all of which are antidotes to mental isolation. Research from the American Psychological Association, featuring experts like Dr. David DeSteno, explains how religious rituals enhance emotional regulation, akin to mindfulness practices that calm the nervous system. In a podcast discussion on the Huberman Lab, DeSteno detailed how prayer and gratitude practices markedly improve mood by shifting focus from personal woes to broader perspectives. This is backed by MRI scans showing that spiritual contemplation activates brain areas linked to positive emotions, reducing amygdala activity associated with fear. A systematic review in the Journal of the American Medical Association analyzed data from thousands of participants and found that spiritual care integration in healthcare leads to better outcomes for those with serious illnesses, including decreased suicidal ideation. Faith communities offer social networks that combat loneliness, a major risk factor for mental health issues. Pew's global survey revealed that religiously active people have stronger civic engagement, leading to more fulfilling relationships. Moreover, forgiveness and compassion taught in many religions help resolve interpersonal conflicts, lowering chronic stress hormones like cortisol. Studies on college students show that those with strong faith exhibit greater resilience during transitions, with lower blood pressure and better sleep, a key for mental stability. Even in adversity, belief provides explanatory frameworks. For instance, viewing suffering as part of a divine plan can transform despair into growth. However, not all effects are uniform. Rigid doctrines might induce guilt, but overall, positive religious coping prevails. A 2024 MDPI review summarized 13 studies confirming that religiosity boosts physical activity, which in turn supports mental health through endorphin release. In populations facing discrimination, faith acts as a protective factor, with African American churches historically providing psychological refuge. Globally, in regions with high human development challenges, importance placed on God correlates with self-reported well-being. Neuroscience adds that repetitive prayers mimic biofeedback, training the mind for calm. For mental illnesses like schizophrenia, spiritual explanations sometimes delay treatment, but integrated approaches where clergy collaborate with therapists yield best results. Ultimately, the mental health story of faith is one of empowerment, where belief equips individuals with tools to navigate life's storms, fostering optimism that permeates daily living and contributes to a healthier psyche. Turning to physical health, the evidence is compelling that belief in God and religion can extend life and prevent disease. Longitudinal studies, such as those from the Mayo Clinic, associate religious involvement with greater longevity, better immune responses, and reduced cardiovascular risks. Participants in faith-based activities often adopt healthier lifestyles, influenced by teachings that promote moderation and self-care. For instance, doctrines in Christianity, Islam, and Judaism emphasize the body as sacred, discouraging tobacco and alcohol abuse, which directly lowers cancer and liver disease rates. A Forbes article citing scientific consensus highlights how faith indirectly boosts health by encouraging nutritious diets and exercise, with religious fasts like Ramadan or Lent promoting metabolic resets. Epidemiological data from Stanford shows that deep faith enhances immune function through stress reduction, as measured by lower inflammation markers like C-reactive protein. In a global comparative study published in PMC, Religiosity linked to better health in developing nations, where community rituals provide physical outlets like dancing or pilgrimages. Heart health benefits are particularly notable. Research from Harvard's T.H. Chan School of Public Health found that spiritual community participation correlates with lower hypertension and stroke incidence, partly due to social support buffering against isolation-induced health declines. Endocrine functions improve too, with prayer regulating hormones like adrenaline for balanced responses. Cancer patients with strong faith report better pain management and adherence to treatments, as per Mayo proceedings. Overall mortality drops. A meta-analysis of 42 studies showed religious people live 5–10 years longer on average. This extends to dementia prevention, where cognitive engagement in scripture study sharpens memory. Physical disability is less prevalent among the faithful, thanks to communal aid and positive outlooks aiding recovery. Even somatic symptoms like chronic pain diminish through faith's placebo-like effects, where belief in healing prayers activates endorphins. In pediatric health, religious upbringing correlates with fewer risky behaviors, setting foundations for lifelong wellness. However, benefits depend on positive perceptions. Negative religious experiences can exacerbate health issues. Integrating spirituality in medicine, as recommended by consensus panels, enhances patient outcomes by addressing holistic needs. For healthy populations, faith encourages preventive care, like regular checkups viewed as stewardship. In essence, the physical health narrative of religion is transformative, turning abstract beliefs into concrete physiological advantages that promote vitality and resilience across life stages. Exploring the mechanisms, we see how belief in God and religion translates into health benefits through intertwined pathways. Social support stands out. Faith communities act as extended families, offering emotional and practical help that reduces isolation, a key health detriment. Pew Research indicates that religious engagement boosts civic participation, leading to broader networks and purpose-driven lives. Rituals like communal worship release oxytocin, the bonding hormone, fostering trust and lowering blood pressure. Prayer functions as a stress reliever, similar to cognitive behavioral therapy, by reframing negative thoughts into grateful ones. As explained by Dr. DeSteno, this cognitive shift activates the parasympathetic nervous system, promoting rest and digestion over fight or flight. Behavioral mechanisms include adherence to health-promoting rules. Many religions prohibit harmful substances, encouraging abstinence that prevents addiction and related diseases. Exercises woven in, from yoga and Hinduism to walking pilgrimages, enhancing cardiovascular fitness. Dietary guidelines, like kosher or halal, often align with nutritious eating, reducing obesity risks. Psychologically, faith provides meaning, buffering against existential anxiety and depression. A Guardian article notes that even non-believers can adopt religious strategies for stress reduction and longevity. Neuroscientifically, belief engages reward centers, releasing dopamine during spiritual experiences, motivating sustained healthy habits. Immune modulation occurs via reduced cortisol, preventing chronic inflammation linked to autoimmune diseases. In coping with illness, religion offers hope, improving treatment compliance and recovery rates. Studies on cancer survivors show that spiritual well-being correlates with better quality of life and lower mortality. For mental health, forgiveness practices dissolve resentment, aiding emotional healing. Gender differences appear. Women often derive more social benefits from religion, while men gain from structured purpose. Cultural contexts matter. In collectivist societies, communal faith amplifies health effects. Downsides include potential for dogmatic stress, but positive coping styles dominate in research. Integrating these mechanisms, healthcare providers are increasingly incorporating spiritual assessments, like the FICA tool, to tailor care. Ultimately, these pathways illustrate how faith isn't passive but an active force shaping biology and behavior for optimal health.